Let's head out of here.
I know. Well, good morning, everyone. Grateful you're here. And what we've got for you, and I think you just received it, is building off the work we've done in each of the legislative sessions since 2019 of making sure that we continue to make Minnesota the best place in the country to raise a family, the best place to live, best way to start a business. And a lot of those indicators and those measures are still holding true to that. We also know that if we're going to have these public programs, we need to have program integrity in it. And we have been working at that for years to make sure, and to be very clear, any dollar of state money, especially those being used for programs to enhance people's lives, if that goes to the wrong place, is misspent, or in the case of this, criminals are stealing it, we need to do everything possible to prosecute that. And we've done that here. There's nearly 100 people that have been tried and convicted and are serving time in prison right now. We've taken meaningful steps, whether it be through executive orders, strengthening DHS leadership, engaging independent experts and auditors, and expanding investigative and enforcement units to guide stronger prevention. We do this work not to find headlines, because when you're fighting fraud and convicting people, it's in the headlines. But that work needs to go on, and you've seen an acceleration of that because of the work of the people you're going to see behind me. You're going to hear from DHS Commissioner Gandhi, you'll hear from our Inspector General Clark, and then you'll hear from BCA Superintendent Evans. But I want to make clear at this, the tools that we have and we've made progress on, we put these things forward to the legislature. The proposal that you have there in the package, many of them, if not all, should be incredibly acceptable to Democrats and Republicans across the board. Many of them have been suggested by both of them. We have suggested them. We were not able to get some of them through the legislature. So this is a bipartisan effort. But we're kind of at a crossroads on the fraud fight. We saw an incredibly damaging continuation of the reckoning and retribution campaign by the Trump administration, a totally illegal and unprecedented in this country's move around Medicaid. And you're going to hear again from the team that's here can explain what's going on with CMS, with Dr. Oz, and then adding the vice president into this. Even though, and you'll hear from this, Minnesota's Medicaid error rates are about 2.1%. The national average is 6.4%. There's absolutely no reason, and we're in the middle of working with them, even though we've met, I believe, all of the criteria of an improvement plan in their parlance, I guess. And what they did last night was just another step on that. It is absolutely not serious. It's not meant to fight fraud. How taking health care from 400,000 children, pregnant women, and the elderly, I would ask all of you, did you hear in there what specific steps they were going to take to stop the fraud, or what the specific fraud they were talking about? They're using it as a general term in this, and they're not serious. So we're at a crossroads here in Minnesota. If you like talking about fraud and you think it's an electoral issue for you, that's gone. I'm not running. That's gone. If you're serious about fighting fraud, you can help us work on this package, get this package passed, give the tools necessary to the folks so they can continue to do what we're already seeing, enhanced program integrity that my role was. You saw in Tim O'Malley, who I want to thank again, report that this is something that has plagued governors going back 50 years. Other governors have dealt with fraud. I want to be the last one to deal with it. I want Minnesota's modernization around program delivery to be the strongest. But right now it appears to me that the Trump administration is not serious about that. They're continuing to try and wage this conflict against Minnesota. There's nothing in their plans that works. I continue to hear from the legislature platitudes and mysterious things. Republicans need to be very clear. Do you want to fix it or you want to talk about it? Because it appears to me right now is that they fear fixing this because it takes away what they think is a political leverage. And that is simply wrong for Minnesotans. I've already told you we're taking accountability. We're seeing the fixes. The results are starting to show themselves. This package is needed. I asked the legislature to do it. Not going to make everybody happy. It shouldn't, because we've been told by outside auditors that there are vulnerabilities in the program. The experts have gone back and said, this package will close those loopholes, and that will move us forward. So we're in a good spot, I think. I'm hopeful that we're getting this out there, but we're also fighting two fronts on this Medicaid move. I don't know how to really express just the timing of this, the nature of it, the sense of retribution. No state has experienced this before. How does taking and punishing children and elderly have anything to do with fighting fraud when that's not where this issue was taking place? It does nothing, and they've given us no way to try and show that all the things they asked us to do we've already done. They're not even looking at that. So we've got our work cut out for us, but I'm hopeful on this. I'm not just hoping for a better outcome. We planned for a better outcome. So with that, I'm going to turn it over to someone who took this job on, took it on as a temporary place, had the opportunity to retire, but chose to serve the state. And I think by all accounts, we're seeing both here and in Washington, D.C., the competency of DHS Commissioner Gandhi is making a huge difference. And quite honestly, it's a tough lift because it's also making a culture change that the commissioner has been, I think, very successful at. With that, Shireen Gandhi.
Thank you, Governor. Shireen Gandhi, serving as Commissioner of the Minnesota Department of Human Services. Today, for all the controversy surrounding fraud in state programs, we also have the opportunity to make Minnesota a national model for combating fraud, waste, and abuse. Governor Walz is leading that effort, and for the past year, I have been working to do this, and I will continue to accelerate change within DHS to prevent and fight fraud. We have a consensus around an outcome: zero fraud in our programs. So it's time to think big and act boldly. This week, the Minnesota Program Integrity Director, Tim O'Malley, provided his roadmap report. He found that more than 50 years of neglect of program integrity and oversight efforts created the conditions that bad actors have exploited. He said the state has a lot of work to do to make the next half century better. The governor's executive order, issued in September of last year, accelerated the work that DHS can do as a state agency. But we can't do it alone. As you've heard me say before, there are important changes that require all of us to come together. We need the support of legislators, and we need to tackle these issues during this current legislative session. The governor's plan covers a lot of important ground. For the Minnesota Department of Human Services, it will strengthen our hand in working with managed care organizations. The health plans in Minnesota handle about 80% of Minnesota's Medicaid enrollees. The governor's plan calls for enhanced oversight and increased review of claims that are being paid. We're also tightening oversight of the way we provide services to people with disabilities and older Minnesotans. We're establishing billing limits, new billing limits, requiring providers to keep digital records documenting services provided, and requiring pre-authorization for some high-cost service plans. Last year, we implemented reforms to the Early Intensive Developmental and Behavioral Intervention Program, which cares for children with autism, including the ability to do on-site visits when the provider has not submitted claims. In this legislative session, we are asking for the authority to expand that same ability to do on-site visits to other healthcare programs. There are over 1.2 million Minnesotans who depend on Medicaid services for life-saving and life-enhancing medical care. Almost half of them are children, as the governor noted. We owe it to them to come to the Capitol and have the frank discussions necessary to ensure that they have the care they need. Thank you.
I think we'll turn to Inspector General Clark. Thank you.
Thank you, Commissioner Gandhi, Governor Walz. I'm James Clark, the Inspector General at the Minnesota Department of Human Services. I think we all know Medicaid services are vitally important for the people of our state, and we must do everything we can to prevent Medicaid dollars from ending up in the hands of criminals. To that end, throughout the past year, we have taken aggressive action everywhere we have found evidence of fraud. We've shut off payment to 540 Medicaid providers last year and made over 300 referrals to law enforcement. We are doing more than ever to root out fraud, and we have very strong partnerships with the BCA and the Minnesota Attorney General's office. But fighting fraud requires resources and tools, and the governor has put forward important proposals that will strengthen our investigative and enforcement authority. You heard some of these from Commissioner Gandhi, but some of the proposals in this package that will greatly help our work at the Department of Human Services are enhanced technology to detect fraud earlier and more efficiently, increased staffing for investigations, clear and enforceable policies relating to billing limits in some of these high-risk programs, and as the Commissioner said, more resources for enhanced oversight of managed care organizations that oversee Medicaid delivery to about 80% of Minnesotans. I just want to note, Medicaid oversight is a shared responsibility. DHS has responsibility, I have responsibility, but the legislature also shares responsibility in finding solutions to the problems we face. And at this moment, Minnesota needs the legislature to act to provide additional tools and resources that will help prevent fraud. That's all I have.
Thank you, everyone. Thank you, Governor. My name is Drew Evans. I'm the superintendent at the Minnesota Bureau of Criminal Apprehension. Under Executive Order 2501, the governor ordered all state agencies to combine the criminal investigative resources to combat fraud, a process we've been working on over the last year and was later codified by our legislature last year. That team, consisting of dozens of agents and analysts, continue to combat criminal fraud as those cases are referred to us. As Inspector General Clark noted, there's been a strengthening of our partnerships with the Inspector Generals and a team that's working together to look for fraudsters that are across the spectrum as they work to stop payments, take administrative sanctions, and when appropriate, to criminally investigate those cases. That team continues to work and operate, and part of what's being contemplated today are continuing the iterative process that will continue to be necessary in Minnesota to combat fraud, not only in our government programs, but in general as fraud continues to be a challenge across the spectrum for everything that we do. That team focuses on wage theft, insurance fraud, criminal investigative fraud, that is general financial crimes, and then state program fraud. Part of what's being announced today are expansion of some of our subpoena authority to be able to more quickly move these cases through the criminal investigative process. In that, and the authority that would be vested to ensure that we get the records in a timely fashion so that they move through the process as quickly as possible. Expansion of identity theft definition in Minnesota. One of the things we say, and not necessarily in these programs, but we're starting to see AI being used as a tool for fraud, using the likeness of other people, voices to access all of our funds, whether it be in the traditional banking industry, insurance fraud, or in-state program fraud. And then extension of the statute of limitations for various different crimes such as securities fraud, failure to pay over state funds, presenting false claims to a public officer, theft by swindle, receiving stolen property, and fraudulent statements made to injure or defraud from the 3 years that most of those are now to 7 years, meaning that you will not escape simply because it takes a long time for us to investigate these cases, as they often take years to discover, and then additional staffing to provide additional focus on all of these types of fraud across the spectrum in that unit as they continue to work. That section at the BCA is our largest section right now, showing the seriousness of what all of us are taking to combat criminal fraud across the state of Minnesota. And as the governor and others have noted up here today, the theft of our public funds in particular is particularly egregious because we have individuals preying on the good nature of Minnesotans, taking those funds for their own selfish purposes, while those Minnesotans that these programs are designed to utilize are now, as has been alluded to, being frozen in some situations and not available for the purposes that they were intended. So as you see today, not only with DHS, but there's a number of different state agencies taking an all-government approach to root out waste, fraud, and abuse in our government programs, and we're committed to continuing to do that.
And I'd just like to say that this approach, and as you heard from increased penalties, enhanced opportunities to use AI, investigators being out there, changing some of the rules we have, asking the legislature to help us with this, all the things that have been identified as problems, this is a solution to it. So the White House solution to this is to take health care from poor people. Our solution to it is catch these people before they do it, and if we don't, to lock them away for a long time. Much more practical, actually gets to it. But I'll have to say, this Medicaid money grab and retribution It's the same pattern. They used false information as a pretense to do Operation Metro Surge. They're using false information or no information as a pretense to take our tax dollars from a state that has some of the best outcomes in the country on health care, has some of the lowest error rates on Medicaid, and now asking us to turn away people who need that health care. So I'm real proud of this team. I think we got a great package here. We need the legislature's help, but as I said, this should be hugely bipartisan. And the only reason I think you wouldn't make a move on many of these proposals is you like to talk about fraud rather than fixing it. With that, Quay.
Governor, good morning. In the past, you've spoken highly of the U.S. Attorney's Office and their efforts to combat fraud. Given the changes we've seen in that office in recent weeks, given the leadership change at the top of the office, do you believe that the U.S. Attorney's Office is equipped to continue this work? And do you think they can do so with integrity and in an even-handed manner?
No, it's a great question. I'm going to turn to Drew who has a little bit. I don't put you on the spot that he works with them on there. Look, I would just say on my side of things, deeply concerned because we did work with these people. They were great partners. Didn't matter Republican or Democrat. And they got some really great conviction rates on that. I myself worry about, you've seen judges chastise and even go after some of these attorneys over there because they're not ready to do it. I've asked the same question of Drew, and then I think the ancillary question on this is can the state just do these prosecutions? And I'll let Drew talk about that.
Thank you, Governor, and thank you for the question. I'll answer it a little bit in two parts, part that wasn't. There's a significant number of resources that have been said in the investigative realm from the Department of Homeland Security investigations that are here, and then the FBI that traditionally investigates those crimes. What I'd say is even if we continue to have disagreements with federal partners on various aspects of different investigations, we don't let those hold us back from partnering. We continue to work at the BCA with those entities that are there on combating fraud. We certainly aren't going to let any disagreements about other cases or approaches get in the way of doing this important work moving forward. So that work continues. With the U.S. Attorney's Office not getting in, certainly the U.S. Attorney, and I think he alluded to this yesterday, continues to hire people. What I will say is the people that were left, I couldn't tell you their political affiliation to this day, and I've worked with them for dozens of years, and they lost really good attorneys. And so that institutional knowledge is hard to replace in some instances with certainly the work that's being done, and we're hopeful that it's there. And if we don't see that in any type of investigation that we're working, we've certainly in the interim been having conversations with, and they've always prosecuted here in the county you're in, and Ramsey County has always been a great partner for fraud cases at the state level. Traditionally, many of them have gone federally just simply because of the scope, complexity, and just the breadth of these cases and how much information is there. So that's certainly a loss if they're not in that position, but it's certainly be in continued contact with the U.S. Attorney's Office, and we have been throughout talking to them about a variety of things in this. But certainly it causes some concern, but then we adjust as we always do in this state, and we'll go to county attorneys with those cases if they don't have the capacity.
Well, have you seen the change? I mean, has there been like a slowdown in their reaction time, or have you noticed anything?
So the question was, is there a change in their reaction time? I don't know if I'd frame it that way, but yes, I've definitely seen a change right now. You said there was short 36 attorneys, I think was the number that was used yesterday. Like no office could replace quickly that number of people regardless of the rationale for them leaving. And so, the fraud remains a focus, and it was there. We are in contact with other attorneys from the Department of Justice that are across the United States working on the fraud program. But what I see in turn is some of the other casework that we're used to bringing there. Other child exploitation cases, drug cases are certainly not on the same pace we're used to seeing.
The money that was threatened by CMS, is that a new threat or part of the money that they threatened before? And will that result in a loss of services?
Yeah, so the answer straightforwardly is John Connolly, Medicaid Director and Deputy Commissioner at DHS. The answer is straightforwardly yes. This is a new threat above and beyond the $2 billion associated with the withholding that they mentioned in the letter to the governor on January 6th. So we appealed that finding of noncompliance and that withholding. We're in that process currently, and that is playing out. While that's happening, they also initiated and they communicated in that letter on the 6th, they were starting a focused review of the 14 high-risk services in the program that we identified. And That review is underway now, and associated with that, what they're saying is, pending the receipt of information from the state to substantiate billing in those 14 services above and beyond the $2 billion in the withholding, they're now saying they're going to withhold, or rather defer. It's a deferral, different technical term, but basically defer payment in federal funds up to $260 million quarterly until we pass through this process. And so our concern is that this could go on for several quarters, which would be catastrophic for the Medicaid program, for children, for people with disabilities, for seniors, for hospitals, for rural Minnesotans, for nursing facilities. So the answer, we feel like this is no longer about fraud, because we have been acting for well over a year and a half to fight fraud here in Minnesota. I think you all have reported on that. And we've substantiated a number of actions before CMS engaged us in December. So the claim that this is necessary to make sure that we're serious about fighting fraud is just not credible. And it took CMS a year to engage in earnest with us on that. So this feels just punitive at this point, rather than helping us fight the problem.
What is the latest on your estimate? How much fraud have you found, and how does that square with the Fed's estimates of $9 billion or more?
We have no evidence to substantiate at this point a $9 billion figure. So if there is evidence out there, and others have suggested at the federal level there is that level of fraud in the program, we need evidence to be able to stop payment to bad actors right now. But we have no evidence to substantiate $9 billion.
Sorry, may I follow up? Ballpark, how much have you found?
So at this point, our investigations are still ongoing. What we found and what's been substantiated so far in legal proceedings, whether it be plea deals or in court proceedings, those are the numbers we're leaning on. The Star Tribune has published figures in that regard, but we don't have evidence to suggest that there are $9 billion in fraud in the program.
Governor, could you comment about continuing to have the attention of the federal government? What do you think is behind this? Immigration action?
If I knew what went on in Donald Trump's mind, I think the world would be really glad to hear me say what it is. I have no damn idea, Mary, what they're thinking. This is, yeah, because I think the number is now 19 billion, according to the president. And, look, the thing about that is, and we've been very candid and open trying to solve this, misinformation doesn't help us fix fraud. Saying false numbers like this doesn't get to the reality of this, the actual tools to do it. Look, I see no other way to view this than I take him for his word when this is reckoning and retribution. They used false pretense to come in on Metro Surge, and we saw the catastrophic damage that was done and the deaths. Now we're seeing them turn to this. And again, I ask all of you, you're very versed at this. You followed this. You see this. So they're going to freeze the money because of fraud. What specific fraud? What did you see that the state didn't do? You've been hearing this. We've been doing all these. They gave you not one single grain of this happened that's fraud. And as we know, it doesn't make it right. This is in every state, and the numbers are bigger in other states because they're bigger, and they're doing nothing. And they're being very specific about this. And look, I don't know when sometimes somebody says that enough is enough. This is a targeted retribution against a state that the president doesn't like. The real shame in all this is a state that does health care as well as anybody. Health care outcomes, health care access, health care providers. We do it as well as anybody. And this Medicaid piece, I don't know how you can't use this statistic. CMS's own numbers say Medicaid error rates in Minnesota are 2.1%. National average is 6.4%. Why are you coming to a state with the lowest in this? And why did you make an arbitrary decision to, what's the word I'm using now they're calling this? A deferral. It's not. It's a ransom note. It's the same stuff they did. They sent that on January 6th of when they're threatening us, and then what they wanted, voter rolls, they wanted everything else. So look, I've asked the president, we're tackling this. We want to partner with you. We need you to quit firing U.S. attorneys who are good at fraud. We need you to quit firing FBI agents because they carried out their job. We need you to partner with us because I don't know why this is so hard to understand. And I will continue to say this. You can trust me on this. The person who's angriest about this fraud is me. There is certainly no political upside to having fraud in your state, and it undermines the very program that I have spent a lifetime advocating for and trying to implement, and we have got criminals. It seems like the Republicans, the only people they're not concerned about in this is the actual criminals. standing with the criminals. This president has pardoned people who took part in Medicaid fraud, who were responsible for paying back almost $300 million. And because he pardoned them, that went away. This is some type of upside down world where we need the adults in the room, and I'm counting on Republican leadership here in the legislature to say, we're going to give them the tools to put people in jail who commit fraud. That would be a great thing. So, Mary, I can't answer you. This is it, and this is my top priority. I'm proud of the work I've done here. I think we've made transformational changes. I think Minnesota ranks where it is. We still are we're the fourth best state for lack of corruption in this. Corruption's very different than fraud. It's very important to me because personally, my fiscal responsibility side, I've always hung my hat on that. I am proud of the teams that we have and the state employees who are taking the brunt of this. And it's time to go after the people who are criminals to, again, if we didn't lock the door tight enough, we got to do better of locking the door. But these are folks that stole from us. So I'll just say this. This was the reason is I am freed up that there are no political considerations. I have the time to focus solely on making sure this happens. And I do want, and it's personal for me because these programs are so important, when I leave next January, I do want that designation that Minnesota's programs have the best program integrity, the best safeguards, the best pre-prevention work that was been done, and that more people are going to continue to go to prison if they did this. So, yeah.
This proposal out here, we've heard the Democrats, we've heard the Republicans come up with their anti-fraud proposals. Are you telling me you want to see this stuff fast-tracked and stop talking about it? And
They should, but look, now after 7 years, I have to be candid with you. I've come in here, and I am truly the eternal optimist. I've come in here and said, we all want a bonding bill. We should have this done by March, and then we're sitting here the end of May, last hours, trying to get a bonding bill done. This one just makes sense because we're telling you what the tools are. The issue on this is that I don't think, and you'll tell me on this, I don't think many of these things are in here are controversial at all. I think many have been brought up by the Republicans. I know the legislature is going to frown on that we're not going to have basic earmarks for programs, but the OLA and everyone else has told us that that's risky. So I'm saying, okay, we're not going to do that anymore. So I'm hopeful. Yeah, I think if we pass it, we get things done. So yeah.
I want to ask about the Optum report. It's largely a mystery to us. We don't know what the vulnerabilities are or the remedies. And I wonder, Director Connolly yesterday said none of them have been implemented to this point. I wonder how many of them are reflected in this list and when maybe we'll know.
Yeah, I'll let them speak. And the folks who know, and this is one that I think we're laying this out there. As I said, there's no political upside. And every time there's a prosecution, it reminds people there's fraud. But just because you're not hearing about prosecutions doesn't mean fraud's not happening. And the Optum report, the thing about that was, and we talked about this, that was basically a stress test on our system to see what's out there, see the vulnerabilities. So I'll speak on the part where the only thing that was redacted is kind of the roadmap for people to commit fraud. You didn't want to give them an idea like, oh, if you do these three things, you could get around this firewall or whatever it might be. But I think using it as a roadmap and a tool, the OLA has done that. Some others have done that. I don't think Tim O'Malley's main purpose was to do that, but he laid out some of those. So I don't know if one of you want to talk where we're at on it.
So the parts of the report that are redacted in terms of the Optum report and what I commented on yesterday in committee was that basically the analytics that they use for enhanced prepayment review to vet claims before they're paid to providers in the 14 high-risk services. And those we certainly wouldn't want to release to bad actors. So they have a roadmap of how to get around the different tests that we're applying to the claim. So that's one part of what's redacted. The second piece is really the recommendations that you're speaking about. And we're still vetting those. This report was produced in 90 days, so it's still very fresh. Our policy teams are looking through those recommendations, and they're really about policy changes or programmatic changes that we could make to improve the program integrity of the program. Some we might need to tweak, and some will, of course, require legislative action to implement, and we'll have to confer with the legislature about those as well. So we have to abide by the Minnesota Government Data Practices Act, which, for better or for worse, that's just the reality of the law, treats legislators as the public. So we can't share redacted portions, security data, so to speak, with legislators, but we are looking for, I think, ways to share more information with them, whether it be verbally, if that's permissible, in addition to reviewing, I think, with a fine-tooth comb the report one more time to see if there's anything else we can unredact, so to speak.
I also wanted to ask, I saw that you guys were looking at strengthening managed care oversight. Is there any concern of providers billing multiple MCOs along with DHS in order to defraud the system, and how will separate pre-payment review processes address that?
So there are different firewalls in place in the system that would prevent providers from billing for the same person in different places because they would be enrolled with a managed care plan that had responsibility for those services or benefits. And there may be other services or benefits that are billed through the fee-for-service program for the same person, but not two things in different places. And so our systems have coding to prevent that from happening. And while we ingest all the claims on the fee-for-service side and pay those bills to the providers, we also receive all the claims from managed care plans as well. So we receive that information too.
We have time for just one more. I'm going to do one on this, though, to enlist all of you. I just am. Why doesn't the legislature have data practices? It's insane. The FOIA requests for Congress and other things in this. Why does Minnesota not have data practices requests for the legislature to understand? And some of these questions be asked. Why wouldn't you sign for this? Who are you communicating with? Did someone talk to these people before they came? You had legislators admit that they talked to YouTube bloggers to set things up. I just would go back to this again with us. I do believe in this transparency piece. I know it frustrates you, but we give millions and millions and millions of pages. We've got an issue now is that we can, if we're going to tackle fraud, if we're going to tackle transparency, if we're going to be in this together, this would be an opportunity for the public and the media to say, why are we one of the very few states that doesn't allow data practices request of legislators? That's my PSA for the day. Who gets the last one? Yeah, go ahead. So, go ahead. Yeah.
The quarterly payments, when are the quarterly payments usually made? And if this $260 million is not made, what programs and patients are affected by it?
So I'll answer the first part first and the second part second. So the first quarter to which this is going to be applied, this deferral, is quarter 4 of 2025. So we will actually have to pay back that amount to the federal government. So that's when it begins. And then there are different data requests that they are submitting to us that we have to meet. And if we're unable to resolve their concerns within a certain time frame, they may take that money going forward in future quarters. With respect to the impact, it's really to the state budget broadly and to the program broadly. And again, that's why we listed all of the different providers and people that would be impacted by this, because we're already facing budget challenges in the state, and this just exacerbates that challenge. And so there will have to be difficult decisions made in the budgeting process with respect to how the state would absorb this impact.
And so because it's Q4 2025, the state government writing a $260 million check to the feds right now?
That's right. We'll have to pay that back to the federal government as a part of our claiming going forward. So we will have to essentially pay the federal government that amount for quarter 4 of 2025.
Governor, OIG, 2 parts. Do you think that the OIG should have law enforcement powers? And also, do you think that you should appoint the Inspector General?
That we should what? I'm sorry.
That you should appoint do you think you should have the authority to appoint the Inspector General?
The overall Inspector General, the one that came up. Yeah, I think this team could speak on that we're fine with working with them. I was last legislative session of working how we get that. I just want to get these right people in place.
But, sorry, just the bill's held up in committee over whether or not the OIG should have law enforcement powers and whether or not
You want to speak to that? What an OIG? Drew? Yeah.
You know, I can speak to that in the discussion that's been ongoing about that. That was, the Senate version of that bill that was amended on the Senate floor to add those law enforcement powers. What we've said throughout and going into this, there should be strong investigative authority within an Inspector General's office if one were to pass at a statewide OIG. It's important to clarify, though, the different types of investigations that occur. The Inspector General's offices that exist now do administrative, regulatory oversight investigations within their program integrity. And when they discover criminal fraud, it is handed off to the BCA, who has a financial crimes and fraud section consisting of dozens of people, I think 46 people that are currently in that section. What's being contemplated in that bill is a very small law enforcement function that would be ineffective from our perspective. It's expensive to run a law enforcement agency. There's a lot of regulation. It's complicated. And so our perspective is when we need to implement, as the executive branch, what's passed by the legislature in this process, that we want it to be effective and do exactly what everybody wants it to do. And so the Inspector General has to work very closely with an organization like the BCA to ensure there's not redundancy, that we're working together. What we have said is to address any concerns along the way that might pop up as they're contemplating these bills, is there are ways to require interaction, oversight, be able to have access to active criminal investigations that maybe isn't often done in the process to ensure that an Inspector General would understand what's going on at any time, to allay any concerns about any particular administration, whatever that might be. Although I've said it numerous times in committee and other, the governor and everybody I've else worked for has told us when we're doing criminal investigations to follow the evidence where it may go and does not interfere or guide any of our investigative work.
Governor, quickly, what are you expecting in your testimony next week in D.C.?
Hard to say. We'll talk to them, tell them the facts that are out here. Again, I hope they're serious about combating fraud. They requested I go there. I'll go there. A little frustrating out of the state when we're doing these things. That committee has a tendency, I believe, Hillary Clinton's testifying on Epstein today, so I think you know with that. But it gives me an opportunity, though. I'm really looking forward to it, an opportunity to talk about all the great work we've done, I think, moving on this. And I think there's lessons for other states, because I talk to other governors and be very candid. They all know that this happens in all states and how we get at it. So I hope it's a good faith effort to really get at this, a good faith effort to talk about what we've done, what we're trying to do. And I also want to know is, when I'm out there, and I'll just preview this for you, this is congressional oversight. Where is the oversight on the investigations into 2 dead Minnesotans? Where is the investigation of what happened to Minnesota during Metro Surge? You want to talk about, I'm more than happy to talk about fraud. I would like to also talk about what's been done here and why there was no oversight of these untrained, aggressive agents who did what they did. So I think you'll see a little bit on both sides. I'll get a chance to talk to you tomorrow. We got forecast tomorrow, and I won't forecast the forecast, but we'll get some time on that. So.